I'm Dr. Joe Esposito, and welcome to our podcast, For the Health of It, episode 80. Remember to subscribe to our podcasts, and I'll help you naturally get well and stay well.
The information presented on this program is not intended to take the place of your personal physician's advice, and it is not intended to diagnose, treat, cure, or prevent any disease. Discuss this information with your own physician or healthcare provider to determine what is right for you.
Are you suffering needlessly? Dr. Joe can give you advice on how to naturally get well and stay well. Dr. Joe Esposito.
What we're talking about today are tips to have you obtain and maintain optimum health. So we're kind of giving you a little rapid fire, do this, do this, do this, do this. Some of you are going to pick up on some things, some of you are going to pick up on the other things. That's fine. You don't have to get everything in each show. That's why we have over 1,000 hours of podcasts on my website, drjoe.com. So you could listen to shows. And I know I talk fast. In fact, at the break, I was warned, slow down. And it's true, but I get excited because there's so much good information. And if I talk too fast, you probably have to listen to the shows over and over again. They're on the website. You can download them on SoundCloud. We have YouTube. We have audios, videos, however you learn. We have a blog that we keep. Send us your email address because we send out newsletters periodically. We send out specials. Sometimes Garrett, my marketing guy, will put together a special on supplements. We do special lectures, breakout lectures sometimes just for people on our newsletter list. So if you want to do that, go to my website, drjoe.com, and just send us your email address. I'm more than happy to put you there. Follow us on Facebook, follow us on Instagram, and the reason is we live stream a lot of our shows, and you get to watch them live. And we send out information on Facebook and Instagram as well. But we want to help you get well, and we're trying to give you as many ways to get the information as possible. Audio, video, written, newsletters, live stream. We want to do whatever it takes to get you well. And a lot of people a little stubborn, probably like yourself. So we're talking today about tips to get well and stay well. We started talking about intermittent fasting. So what happens is, if you eat late at night, these free radicals are formed. These free radicals are like Pac-Man. They eat through your cells, and they can damage your DNA, and they can damage your mitochondria. And here's the thing, this will get everybody's attention, it speeds up the aging process. So a little trick you can do to slow down the aging process is something called intermittent fasting. So as a general rule, eat your last meal at least 3 hours before you go to bed. Sometimes you cheat. I know you do. I know you. What happens then is you'll suffer. And think about it. You have a meal late at night, you'll probably wake up a few times to go to the bathroom. You may have weird dreams. You may toss and turn. That's all just eating too late. So minimum of 3 hours. So if you eat at 5, you can go to bed at 8. If you eat at 8, you better go to bed at 11. I'd rather you even skip dinner. We're going to talk about that in a second. Intermittent fasting can improve your insulin regulation. It can lower your risk of heart disease. One of my friends, very dear friend of mine, was very, very obese. Big guy, probably 6'4", 375. Didn't see him for a couple of years. He comes into my office the other day, and I'm looking at him. If he didn't speak, I wouldn't have known it was him. He dropped down to about 210. Well, he was diabetic, and the doctors, and I warned him years ago. We hung out together all the time. You know, Alan, you gotta change your diet. Yeah. Well, diabetes got so bad that the doctor said it's going to kill you. So he had his stomach stapled together, stomach bypass. Not a big fan of that surgery, by the way. And anyway, lost a ton of weight. Diabetes went away. Oh my gosh, it worked. There's a problem. He's now in stage 4 kidney failure. Because what the doctors told him to do, and this is where I disagree with some of my colleagues on this, is they put him on a high-protein diet. You only have a small amount of stomach left, so you have to eat a high-protein diet. So he was eating chicken and steak and very high-protein foods. Well, you only need about 8% of your total caloric intake as protein. Anything beyond that is wasted. And when it's wasted, it has to be filtered out of the system. How does it get filtered out of the system? It goes through your kidneys. So this high-protein diet that he was eating was putting such a strain on his kidneys, he's now in stage 4 kidney failure. And the doctor said, well, what do we do? He said to the doctors said, well, we got to put you on dialysis, most likely, and then we probably got to start thinking about a kidney transplant. So wait a minute. You had your stomach stapled, you had a stomach bypass to help you lose weight, to help the diabetes, and it worked great. Now you have to have your kidneys replaced. Why didn't we just work harder to get him fixed? You know why? He didn't listen to me, of course. I was his friend. And somebody famous once said, no man's a prophet in his own hometown. And boy, is that ever true. But now he's regretting it. He came in, he says, Joe, you're the last guy, you're the guy I come to, man. You're the expert, you're the number one guy in the world as far as I'm concerned. What do I need to do? So now we got to get him on a low-protein diet, high-nutrient diet. Big difference. High nutrient diet would be things like Dr. Joe's Super Greens, Dr. Joe's Essential Source. I'm probably going to get them on Dr. Joe's adrenal support because the adrenal glands produce adrenaline, they produce sex hormones, and they produce anti-inflammatories. So we can get him on adrenal support. B-complex to get his nervous system working properly. We got to get him on super high concentrations of nutrients, and Dr. Joe supplements are a great place to start. And if you want to get on them, those are on my website, drjoe.com. But a simple thing that he could have done, coming back around again, to help lose the weight is something called intermittent fasting. So what you want to do is you want to cut out your bad foods, alcohol, meat, sugar, dairy, coffee, soda, and artificial sweetener. You want to get on good nutrients, Super Green, Essential Source, B-complex, adrenal support, vitamin D was where I would start somebody like you. Eating more fruits and vegetables. Have a salad at least once a day. One meal a day should be a salad. Now, that salad can contain things like nuts. It can contain things like raisins, organic, of course. You can put nutritional yeast, which I strongly advise everyone use nutritional yeast on a daily basis because nutritional yeast has a certain type of beta-glucan that's been shown to help the immune system. Studies have shown that a little bit of nutritional yeast can be just as effective as a flu shot in certain seasons. Like if you take a teaspoon of nutritional yeast, it can reduce your risk of cold and flu by about 30%, 35%. Certain flu seasons, the flu vaccine is only about 30 or 35% effective. So there you go. So nutritional yeast, good call on your salad every day. I have a salad usually for lunch, sometimes for breakfast. Dr. Joe's Super Greens and Essential Source and all my supplements first thing in the morning. Can't start the day without them. If I'm hungry, if I did intermittent fasting the night before, I usually wake up hungry, I might have maybe some oatmeal. I'll just take some rolled oats, organic rolled oats, put some don't even cook them. Put some raisins in there, maybe some coconut milk and have that. Snack usually could be my salad, could be a couple of handfuls of nuts. Today I had some nuts as a snack. And then lunch comes around. It can vary. I like soups in the winter. It's really easy and cheap to make. And if you don't know what to cook, by the way, I got the answer for you. Go to my website, drjoe.com, and we have a book called Eating Right for the Health of It. And the first half of the book tells you how to change your diet, and the second half of the book is a bunch of recipes. And in fact, I hear a buzz that we're going to start doing recipes as little 10-minute videos. So if you subscribe to our YouTube channel, or send us your email address, you'll be getting these little videos on how to make meals in 10 minutes or less. I can't make it any easier for you unless I make them for you, which, by the way, I'm not going to do. Okay? You have to make them yourself. But we're going to show you how to make meals. It's so easy, and the book is great. So had we got Alan, my friend, who had the obesity and the stomach stapled and now the kidney failure and the diabetes got better, what a mess. He's 50 years old. He's got kids. He said, breaking the news to my kids, I was crying. What a tragedy. So we go on intermittent fasting. In a perfect world, you skip one meal a day. So you want to eat in about an 8-hour time period, and if you can, fast for 16 hours. Now, that may sound like a lot. How about I do this? I'll cut you a deal. Don't eat for 12 hours a day. You know how easy this is? It's ridiculously easy. If you have dinner at 5 o'clock at night, you can have breakfast at 5 o'clock in the morning. You just fasted for 12 hours. Now, you could drink water, you can have teas if you want, or broth, vegetable broth. But don't eat for 12 hours a day. That's step number one. That's the easiest thing you can do. No more late night snacking. That's done. Once you get good at that, which you should do every day anyway, then we're going to go into phase 2. And phase 2 of intermittent fasting is I want you to skip one meal a day. I do it with dinner. Now, I don't do it every day. I might skip dinner two days a week. Let me tell you, those days that I skip dinner, I'm a little hungry. I'm not going to lie to you. I feel so good the next day. And when people have cold and flu season, I always tell them, at least skip dinner. Let the body heal. The number one consumer of energy we have is romance. The number 2 consumer is digestion. So if you're sick, you're using up a lot of energy to fight the infection, and then you're throwing food on top of it. And worse yet, it drives me nuts. People will put heavy foods like wheat and dairy, pizza, ice cream. They're comfort foods, but those are the number 1 and number 2 food allergens, blowing out your immune system even further. So when you're sick, gentle, easy to digest foods, salads, soups, easy on the nervous system, easy on the digestive system, so that you have that energy to fight the infection. So intermittent fasting, 12 hours a day. Do that right now, starting today. From now on, that's it. There's no more breaking that rule. And then 2 or 3 days a week, I want you to skip dinner. You'll save money. You'll feel great. You'll have so much energy. And the first couple of days, yeah, you're going to be hungry. Oh my gosh, I'm going to starve to death. I'm never going to make it. You'll make it. I promise. And then what'll happen is you're going to go, oh, when can I intermittent fast again? Oh, I don't have any plans on Tuesday. I'm going to skip Tuesday. I don't have any plans on Thursday. I'm going to skip Thursday. And you start looking forward to it because you feel so good. And another trick about intermittent fasting is it'll jumpstart your diet. How many people have been on a diet and then hit a wall? Almost everyone. Well, I don't care if it's keto, if it's high protein, low protein, programs, Dr. Joe's programs, you hit a wall at some point. I don't know what else to do, Doc. I'm doing everything. I feel like I'm starving. I'm not losing any weight. Okay, let's jumpstart your metabolism. Let's do some intermittent fasting. You'll be fascinated at the results. Promise. It works for everybody, and it's free. So that's what's kind of neat about it, too. Make sure when you're fasting, if you're going to a longer fasting, make sure you're doing water. You have to do water because the body needs water. Pure water. Get a good water filter. Filter out your water. Any type of water filter is better than no water filter. But in my house, I have a water filter. It's about 4.5 feet tall. It filters every drop of water. Because when I take a shower, I'm getting this chlorine on my body, and it's opening up the pores. The heat is opening up the pores, and chlorine and fluorine can be absorbed into my body. If you take a hot shower, you're getting the same amount of chlorine as drinking 8 glasses of chlorinated water. I don't want chlorine in my body. Chlorine is a poison. And so that's why I filter every drop. If you have a toilet, I'm assuming you have a toilet, and chlorine is in the water's evaporating right out of your toilet, chlorine's getting in the air. Then these are little things, but when you add up all these little things, you put together a healthcare plan. If you've listened to my shows before, you know I have a 3-step healthcare plan. Normally functioning nervous system, normally functioning digestive system, good nutrition. That's the core. Then we add this other stuff to it, and it's fun. And you save money, and you feel great, and there's no downside to getting well. As a chiropractor, I've treated thousands, I'm guessing tens of thousands of patients in my career. And when patients come in, they say, I suffered for so long, Doc. That's all it took? In most cases. You know, the average treatment plan in our office is maybe 8 to 12 weeks. And not every day, of course. And they're like, that was it? I suffered these headaches for 20 years and that was it? And they get a little disappointed. Like, I wish you could have done something a little more drastic, a little more dramatic. So no, you just got to get adjusted, fix the stomach, get on a good diet. Oh, okay. And then I had a patient come in the other day. They look at the bill from the hospital. Lady's been going to the hospital for 2 years now. And severe pain down her leg. She's 82 years old. And nothing's working. They've had every possible thing done, and they said, we don't want to do surgery. You're too old, blah, blah, blah. So she comes in, and her and her husband are sitting there. We go through the whole process, and we explain we need to do spinal work. We need to adjust the leg, and this is how much it's going to cost. Well, the husband said, I don't know if I want to pay that. It's like, well, you know, your copay for your insurance is $8.35. And then we had to charge a little extra to work on the leg. And he was just whining, and I said, it's your call. I said, all right, you decide. And I walked out of the room. And as I was walking out, the wife looks at him. She goes, I'm getting this fixed. I don't care what you say. It's my leg. And she snapped at him. And I thought, okay, we know who rules the roost in that house. But when they looked at all the money they spent, and then they looked at how much their entire bill with nutrition and supplements, it was a fraction of what they had spent before that. And when my staff finally laid it out to me, I go, yeah, I guess you're looking at it that way. You're right. So don't let insurance companies dictate your health care. Because everybody says you have to have insurance. Everyone needs insurance. It's not a political argument. But when you have a $7,000 or $8,000 deductible and you can't afford to buy insurance anyway, you don't have insurance because you don't have $7,000 to pay the deductible anyway. Make the decision to go the least expensive, most effective way to get well. And in my mind, for most cases, not all, normally functioning nervous system, normally functioning digestive system, and good nutrition. So if you want to make an appointment to come see us, go to my website, drjoe.com, and you can do it. We have offices in Marietta, Duluth, and Stockbridge in the Atlanta area. And we want to be your doctors. And we can do telemedicine. It's called telemedicine. We're not medical doctors. We can do telehealth care if we need to. If you're not in the Atlanta area, you can come visit us. Atlanta's a great city to come. We have a lot of people fly in and spend some time here in the city and visit us and see us as patients. But stop suffering. Make the decision. Neck pain, back pain, shoulder pain, car accidents. If you've ever been in a car accident, ever, if the car was damaged, you were damaged. So go to the website right now, drjoe.com. You can call us if you have questions. Make an appointment today. So we're talking today about little tips that you can do to get well and stay well. I got to talk about cell phones and electromagnetic frequency, because if you're not doing anything about electromagnetic frequency, you need to. Electromagnetic frequency is electrical waves. And they get into the body, and your body is an electrical field. I teach all my patients your body is like a Christmas tree, and all the wires are connected. Well, if you put an electrical field into your body and it messes up that electrical field, it can make you sick. It's called electromagnetic frequencies. And they're all over your home. Your cell phone has them. And we talk about outdoor pollution, but very few people talk about indoor pollution. When we talk about indoor pollution, we have to talk about electromagnetic frequencies. And one of the problems with it is you don't see it, you don't smell it, you don't taste it, but it's there. But alternating current magnetic fields, like power lines, radio frequencies, cell phones, Wi-Fi, it's called, I'm going to say affectionately, dirty electricity. It's getting into the body and messing with you. Electrical fields have long been known to cause problems. I remember years ago I was doing lectures about high wires, and people that lived under high wires, electrical wires, had a higher rate of cancer. Oh, it's not true. Well, it turns out I was right. It turns out I'm usually right. In fact, we're going to put a whole show together one day, I think, on a Dr. Joe was right, and just have a column of all the things that Dr. Joe talked about 30 and 35 years ago that have now come to fruition, that are now commonplace. Margarine is one thing that comes to mind. How I talked about how dangerous margarine was before it was cool to find out that margarine was probably the #1 cause of heart disease, hydrogenated oils. But I digress. So electromagnetic frequency, be careful with it. With your cell phone, I do not recommend you carry it on your body. Carry it in your hand, put it in a purse. When I get to my car, I usually put it in my pocket. If I can carry it in my hand, I do. But I'll put it on my seat next to me in the car. Put it far away from you in your bedroom so that you're not getting electromagnetic frequencies around your head all day. My Wi-Fi at my house, I have a timer on it. Little $12, $8 timer actually I got, like for a Christmas tree. And I set it, and at 7 or 8 o'clock at night, it goes off, and it comes back on about 6 o'clock in the morning. So I'm not sleeping surrounded by electromagnetic frequencies. Again, is it extreme? No. Getting sick is extreme. This is not extreme at all. It's kind of fun. So be careful with electromagnetic frequencies, and they do affect your DNA, the nucleus of your cells, and the mitochondria. So they can actually open up the cells. And in fact, I did a show a while ago on cell phones. And what happens is, in the heart, it can open up the calcium channels and dump calcium into the cells. We talked about the heart specifically in that show. And when calcium got into the body, it produced free radicals. And the free radicals can eat away at the mitochondria. So with your cell phone, I have a cell phone. I'm assuming everybody has a cell phone. Just don't hold it too close to your body. Ladies, please don't put it in your bra when you're carrying it. So dangerous, because the electromagnetic frequencies can get into the breast tissue, and the breast tissue is very sensitive to electromagnetic frequencies. Don't let children talk on a cell phone. If you have to put them on a cell phone, put them on speaker or put a wired head cord, which is what I use. I have a wired cord or my speaker. And I see it all the time with kids. If you're going to let your kid play with the phone, put it in airplane mode. That's a good idea. If you use your phone as an alarm, put it in airplane mode. I mean, you're not going to get phone calls, of course, in the middle of the night if you need them, but that's a safer way to do it. You're not then sending and receiving electromagnetic frequencies. So it's pretty important. Microwave ovens, not a big fan of microwave ovens. If you have one, don't use it. I have one. And in fact, somebody came to my house a while ago, and I have it in my pantry on a shelf somewhere. And they went, microwave oven. You have a microwave oven. Oh my gosh. I said, the only reason I have it is because I take my sponge at the end of the day that doesn't have metal in it, put it in the microwave, and turn it on for about 30 seconds. The microwaves can actually kill viruses, germs, and bacteria in my sponge. Well, guess what? If it can kill viruses, germs, and bacteria in my sponge, it can do that to your body. So if you have a microwave, don't use it. If you do use it, stay far away from it. But the only reason I have it is to kill my sponge cooties. Now, you can put it in the dishwasher too, but I do it every day. I don't wash my dishes every day because I don't have enough. But EMFs can affect neurological issues, things like depression, Alzheimer's. Work on that, folks. If you know somebody with neurological issues, clean up the electromagnetic frequency in their lives. I think you'll be real happy with that decision. And a microwave, again, we talked about that. We talked about pure water, very important to make sure you're getting pure water. Get yourself a good water filter. It's very important. In fact, we're looking right now. There's one company I talked to, and their customer service wasn't what I wanted. So I found another company. I need to meet with them in the next couple of weeks and hopefully be able to carry water filters on our website. But once again, I don't carry anything on the website unless I know it's absolutely positively top of the line, like the supplements. It was funny, a while ago, we got delayed a shipment of Super Greens and Essential Source. It got tied up somewhere, and we were about 2 weeks late on getting the shipment. You would have thought we killed somebody. Patients were going, no, where's our Super Greens? Where is our Essential Source? I need that stuff. It's been a week since I've had it. Trust me. Get some Super Greens and Essential Source. Go on the website, drjoe.com. Get a month's supply. Relatively inexpensive, a couple of dollars a day, literally. $2, I think $2.10 a day for both. And do it for a month and see what happens. If you're happy, keep doing it. If you're not, don't do it anymore. But I don't know anyone who hasn't been happy taking Super Greens and Essential Source. The only issue I've ever had actually with it is every now and then if a patient is really, really, really sick and they start taking it, it can help you to detoxify. And some patients will say, Doc, I just don't feel good when I take it. You're detoxifying too much. I have to cut back their dosage to maybe half or a quarter dosage and let them build up to getting this healthy stuff in their body. Because they don't have healthy stuff in their body, body doesn't know what to do with it. It's kind of funny. But if you're not going to do anything else, at least Super Greens, Essential Source, and Vitamin D, those are on the website, drjoe.com. And if you have questions, I forgot to mention this too, send me your questions through the website. I'm more than happy to answer your questions. Because so many of you listen to the shows and watch the shows and you go, I wonder about, write it down. If you're like me, you forget things. Go to the website. There's a way, contact us, send it to me, and I'll be more than happy to answer any questions I can help you with. If you have access to a sauna, I like that. It's called a near-infrared sauna. Because what happens is when you start eating right, you start to eat more fruits and vegetables, you're getting chiropractic care, opening up the nerve supply, getting the muscles balanced, fixing the digestive system, your body starts to release a lot of this junk, these toxins. And so you want to get it out of the system. And a good way to get it out of the system is sweat. So if you have a near-infrared sauna, if you have access to it, it's a really great way to do that. And what's cool is the near-infrared saunas can actually help detoxify heavy metals. Mercury, lead, aluminum. Those can build up in the body and cause some real serious damage, especially to the nervous system. Now, as chiropractors, my team of doctors and I are very concerned about your nervous system. And if we gave you the best chiropractic care in the world, which hopefully we like to think we do, but you have to judge that. If you're not taking care of the chemical aspects of your health, the physical aspects are going to help, but they're not going to give you everything you want. So that's why when patients come in, I like to check their nervous system, I like to check their digestive system, and I like to look at their diet and recommend supplements, because even though I eat about 60% of my diet raw, mostly organic, I still take supplements. And with cold and flu season, I was watching people left and right dropping around me. It's like, I don't know, not even a runny nose. And if I feel anything coming on, we have Dr. Joe's Immune Booster, Dr. Joe's Wellness Booster, I should call it. It helps stimulate white blood cell production. And if I do start feeling a little sick, I take Dr. Joe's Seasonal Tonic. And those are on the website too. And they're droppers, and the Seasonal Tonic is ginger, horseradish, cayenne pepper, onion, and garlic. So it can fight viruses, germs, bacteria. Now again, this is not in place of medical care, but if I start feeling a little under the weather, I have a regimen that I follow. I follow it every day anyway, but if I start getting a little weak, I'll take these other things. Don't get sick. I see so many of my colleagues, scratchy throat, runny nose, missing work. My boss calls me, hey, I need you to come cover for this shift, that shift. All right, I'll be there. No big deal. A lot more fun to be healthy than it is to be sick. But a near-infrared sauna is something that can also help you detoxify as well. So if you are getting sick, sitting in a sauna stimulates the immune system, because viruses like to grow in cold weather. This is one of the several reasons people get sick in the winter, is viruses like cold weather. So if you can raise your body temperature, the viruses don't do as well. So maybe take a steam shower, maybe take a hot bath. When you keep your body warm, the viruses don't do as well. Then you take, of course, Dr. Joe's vitamin D3, and then you take Super Greens and Essential Source and the Wellness Booster and a Seasonal Tonic and the nutritional yeast that you put on everything you eat, at least a teaspoon a day. And so now you start to see a pattern develop, and people say, I don't know what to eat. Well, just eat the healthy stuff. Have a salad, nutritional yeast, some nuts and seeds. There you go. And it doesn't have to be just lettuce. It could be tomatoes and onions and guacamole and avocados or whatever you like on your salad. You'll be fascinated when you start doing these things, how quickly the body starts to heal. It's not hard. So if you have a healthcare problem, come see us. In the Atlanta area, we have offices in Marietta, Duluth, and Stockbridge. And we're more than happy to set up a time for you, your friends, your family, and your children. I am so excited when I see children come in our offices. We see a lot of kids in our offices because children, first of all, they heal a lot faster than us old folks. And if they start out straight, their spine is straight and they're healthy, chances are they're going to have a lot healthier life. So don't ignore your children. It's really important that they get taken care of as well. And for the super greens, the essential source, the vitamin D, we talked about B complex, adrenal support. We have digestive enzymes, probiotics. I didn't even cover probiotics today. You're going to have to do a second show on this one. I think we got too much to cover here today. Go to my website, drjoe.com. You can order the supplements right there. If you come by our offices, you don't have to pay shipping. How easy is that? So now we're saving you money again. And if you want to come by and make an appointment, even better still, because we want to put together a healthcare plan for you, your friends, and your family. Try to eat mostly organic if you can, because organic food doesn't have pesticides and it has higher levels of nutrients. So folks, got a lot more to cover, but I'm Dr. Joe Esposito. The website is there 24 hours a day for you, drjoe.com. Follow us on Facebook, follow us on Instagram, send us your email address. We'll put you on our newsletter list. Folks, naturally, we want to get you well and keep you well. I'm Dr. Joe Esposito. Thanks for tuning in. Thanks for listening to For the Health Bit. Remember to subscribe to this podcast, and I'll help you naturally get well and stay well. You can also listen to and call into my radio show live Sunday evenings from 7 to 9 Eastern Time on WSBRadio.com and on the WSB Radio app.